As we get older, so do our teeth. Decay, trauma, fillings, or even the way we chew can make our teeth wear down as well. Placing a crown over a weakened tooth can help the tooth from breaking or wearing down even more. Crowns are also used to restore stained or misshaped teeth, as well as to shelter a tooth that has had a root canal. A crown may not last forever. It may need to be replaced if it has become faulty or worn down. If you are in need of a crown, allow your dentist a couple of visits to complete this treatment. For your first visit, the doctor will numb the area around the tooth to help with any discomfort. Then, your dentist will use a dental instrument to form and prep the tooth so the crown will fit properly. Sometimes an additional procedure may need to be completed to ensure a good fit for the crown. This procedure is generally what's called a build-up. Its job is to help support the crown. A mold of the tooth will be taken and a temporary crown is placed to guard the prepped tooth. The mold is sent to a dental laboratory where a customized crown is made just for you. Once the dental office receives your crown from the lab, you will be appointed to have your crown delivered. If you are satisfied with the shape, color, and fit, the crown will be permanently cemented on your second visit. However, the crown received from the laboratory may not fit as well as the doctor and you would like it to. To achieve optimum results, another mold will be taken and sent to the lab for another crown to ensure a proper fit. Once the numbness has worn off and the crown is permanently placed, you may experience some soreness. There may also be slight pain when you bite down, or the change in temperatures may cause sensitivity for 3 to 4 days. If you are having any discomfort, you may take over-the-counter pain medication as directed by your dentist. If after a few days you're still experiencing discomfort and sensitivity, please call the office to make an appointment. Sometimes the crown may feel too high when you bite down. Please make an appointment to have your crown adjusted. This can also cause you to become sore. You would think that you could just get a filling. Unfortunately, when a tooth is in need of a crown, the tooth is not strong enough to support a filling. If your dentist places a filling instead of a crown, you could do more harm to that tooth in the long run, and your dentist may not be able to salvage it. Remember, the lifespan of your crown is based upon the resources used to create it, how well you maintain your oral hygiene, the food and drinks you consume, as well as the condition of the surrounding teeth and gums. It is imperative that you continue to properly floss and brush every single one of your teeth. Please feel free to contact your dentist with any concerns.
The 6-point plan to a new you. Everyone wants to look their best. Smooth skin is the key to giving your face its natural youthful beauty and a nicer looking smile. Facial wrinkles are part of the aging process and can make you look worried, angry, and tired. This is a result of the facial muscles wrinkling the skin over time when we frown, raise our eyebrows, squint, and smile. These same muscles are often the source of headaches, migraines, TMJ, and facial pain, which directly affect how you look. Facial wrinkles occur in 6 points on the face. These wrinkles make you look older than you really are. To understand where facial wrinkles are seen most often, let's take a closer look at the 6-point plan to a new you. Point 1. Smooth skin between the eyes gives a pleasant look to your face. Are your frown lines more noticeable now than when you were younger? Do people mention that you appear worried or angry when you're not? Look in a mirror, frown, and look at the area between the eyes. Are there frown lines where it used to be smooth? Point 2. Next are the forehead lines, which are wrinkles that make you look significantly older. Make a surprised look and raise your eyebrows as high as possible. Do you see horizontal lines across your forehead? This area can be treated to give you both a smooth forehead, a beautiful lift to your eyebrows, and a more youthful face. Point 3. Wrinkles at the corner of the eyes are called crow's feet. These occur from both squinting and smiling. These wrinkles deepen and increase in severity as we age. Look at yourself in the mirror. Smile and take a look at your crow's feet area. Are these lines more noticeable and deeper than before? Point 4. A fourth distinct area are wrinkle lines that form at the bridge of the nose, which are called bunny lines. Looking in the mirror, pretend you are smelling a foul odor. Do wrinkles extend down your nose? Once these lines appear, they get progressively worse with time and can easily be prevented. Point 5. Troublesome lip wrinkles occur as a result of smoking, water bottle use, and pursing your lips. Looking in the mirror, purse your lips as tightly as you can. Do you see the fine lines that radiate from your lips? Does your lipstick bleed into these lines? A simple treatment can easily smooth these troublesome lines and give you a more beautiful smile. Point 6. Your jawline and neck are also revealing and can make you look older than you really are. Take a look in the mirror and examine your jawline and neck. Would you like to create a smoother, thinner jawline and get rid of a turkey neck? These 6 facial points influence your total look. So, what are the treatment options? Botulinum toxins such as Botox, Xeomin, and Dysport can be used to relax the muscles that cause facial wrinkles and facial pain. This creates smoother skin, a tighter shape to your face and neck, with beautiful natural results, and at the same time relax the muscles that cause headaches, TMJ, and facial pain. Talk to our experienced treatment provider who has been trained in this 6-point face assessment approach now. Our office offers facial pain and facial aesthetics products, including Botox, Xeomin, and Dysport, and volume replacement dermal fillers like Juvederm, Voluma, Restylane, Bellotero, and Radius. Our doctors and team members are trained by the American Academy of Facial Aesthetics.
Nothing looks, feels, or functions like your natural teeth. And with the right care, your smile can last a lifetime. But problems like decay, disease, or injury can threaten teeth and ruin smiles. Thanks to advances in treatment and technology, many teeth can be saved. One way a tooth can be saved is with a procedure called root canal treatment, also known as endodontic treatment. Endodontics is a specialized area of dentistry focused on treating disease or injury to the dental pulp. Let's take a step-by-step look at a modern root canal procedure. Here is a healthy tooth. Inside the tooth, under the white enamel, is a hard tissue called dentin. Inside the dentin is a soft tissue called pulp. The pulp contains the tooth's nerves and blood vessels. It extends from the crown of the tooth into the roots of your teeth. If the pulp becomes inflamed or infected, your endodontist will remove it, relieving your pain or discomfort. Here's how root canal treatment works. First, your endodontist will numb the tooth so that you won't feel anything during the procedure. A small shield isolates the tooth, keeping it dry and clean. An opening is made through the crown of the tooth and into the pulp chamber. Fluid is put in the canals to kill any bacteria and help rinse out debris. Then, the pulp is removed. Using small instruments, the endodontist carefully cleans and shapes the canals. After the space is cleaned and shaped, the endodontist fills and seals the root canals. In most cases, a temporary filling is placed to close the opening until you see your dentist. After your endodontist is finished, you must return to your dentist to have your tooth properly restored with a filling or crown. That protects the tooth and is important to ensure the success of your root canal treatment. A tooth that has had root canal treatment often lasts a lifetime, so you keep smiling with confidence.
Everyone knows that straight teeth give you a beautiful smile. Did you know that straighter teeth can also affect your overall health? Crooked or misaligned teeth, also known as malocclusion, affects 74% of American adults. Left untreated, crooked teeth can lead to periodontal disease and create abnormal amounts of stress on teeth and jaws, which can lead to premature wear. The effects of crooked teeth can worsen over time and may adversely affect your overall health. Common types of misalignment include crowding, spacing, deep bite, open bite, cross bite, edge-to-edge bite, and excessive overjet. Crooked teeth can affect your bite, creating unnatural stress and pressure, leading to premature wear. Teeth that are subject to excessive pressure can develop chipping and notches at the gum line. Over time, the excessive force may also cause flattened or worn down teeth, or chipping and fractures at the edges of teeth. Additionally, a bad bite may produce improper forces on the jaw joint that may lead to pain in the jaw, earache, and even headaches. Premature wear can lead to gum recession, poor bone support at the roots, loose teeth, and eventually tooth loss. Teeth that fit together correctly last longer and are likely to need less costly dentistry in the future. Crooked teeth can affect your periodontal health because it's difficult to remove plaque and bacteria from the crowded areas. Bacteria that is not properly removed will multiply and trigger periodontal disease, which begins as gum inflammation, redness, and bleeding while brushing and flossing. If left untreated, over time, gum inflammation will progress to chronic infection, soft tissue damage, receding gums, periodontal pockets, bone loss, and eventually tooth loss. These conditions can lead to painful repair and maintenance in the future, which could amount to thousands of dollars in expense and countless hours in the dentist's chair. Problems in the oral cavity are best treated in the early stages. Crooked teeth that are left untreated can trap bacteria that damage gum tissue cells and invade blood vessels. This can cause damage to cells that line your coronary arteries, increasing your risk for heart disease, stroke, and other illness. Correctly positioning your teeth for proper alignment and function will help prevent future dental problems and make a significant difference toward a healthy mouth and keeping your teeth for life. Ask your doctor and hygienist today about Invisalign, a series of clear aligners that are custom-made to gradually move and align your teeth. And start on the road to a healthier you today.
7 steps to a new you. Everyone wants to look their best. It's important to consider the total look when we see ourselves in the mirror. Volume is the key to keeping the natural smooth curves in your face and supporting the lips so you can have a beautiful smile. Our face loses volume over time, which happens to everyone. Facial volume loss occurs in 7 distinct areas of the face. You can notice this volume deficiency by the hollows and shadows it creates in the cheeks, jowls, lips, and around the mouth. These shadows make you look tired even when you feel fine. To understand where volume loss is seen most often, let's take a closer look at the 7 steps to a new you. Step 1. Volume at the cheekbones gives structure and a youthful definition to the face. Were your cheeks fuller when you were younger? Look in the mirror and tilt your head down. Looking up, take a look at your cheeks. Is it flat where you once had a smooth curve? Step 2. Next is the front face area. These are flat and hollow depressions under the eyes that can give you a tired look. Tilt your head down slightly, eyes looking up at the mirror. Is there shadowing under the eyes that you now notice? This may be a common feature in your family or due to volume loss in the face as we age. Step 3. Nasolabial folds deepen and increase in severity as we age when volume loss gradually pushes down our face and lengthens the upper lip, hiding your teeth. Look at yourself in the mirror. Smile. Now relax. Are these folds more noticeable? Does it look like these folds are deeper than ever before? Step 4. The next area where lost facial volume appears is the corners of the mouth. Especially as we age, the corners of the mouth can turn down and give you a sad look. Looking in the mirror, can you see hollowing at the corners of your mouth? Now pinch the skin in this area. Does the skin fold? Volume loss gets significantly worse in this area as we age. Step 5 is the pre-jowl area. Gravity gradually redistributes soft facial tissue downwards, causing jowls in the lower face. Tilting your head down slightly, with your eyes looking up at the mirror, you may see the beginning of jowl formation. Have a look at yourself in profile, preferably in a photo with your head tilting down. Can you see depressions in this area? Step 6 is the look of your jawline. Aging alters the smooth curve that runs from the chin to the back of the jaw. As we age, we gradually lose soft tissue in this area, leading to less definition. As you tilt your head forward, do you notice changes along the jawline? Is it no longer smoothly defined? Step 7 is the midface. The midface is particularly affected by volume loss, and over time, cheeks that were once full and well-defined can begin to look flat with a hollow appearance underneath them. Turn your head at a 45-degree angle. Do you notice a loss of the curves of the midface? Does your face in this area now appear sunken in? These 7 steps influence our total look. So, what are the treatment options? Dermal fillers can be used to replace deficiencies in these 7 areas to enhance, rejuvenate, and restore volume, fullness, and structure with beautiful natural results. Understanding facial changes caused by volume loss and knowing what's possible means you can restore your youthful beauty and give yourself a more beautiful smile. Talk to our experienced treatment provider who has been trained in this 7-step face assessment approach now. Our practice offers facial pain and facial aesthetic products, including Botox, Xeomin, and Dysport, and volume replacement dermal fillers like Juvederm, Voluma, Restylane, Bellotero, and Radius. Our doctors and team members are trained by the American Academy of Facial Aesthetics, the worldwide leader in total facial aesthetics.
To get the smile you've always wanted, Invis is the answer. You have a bunch of choices when it comes to straightening your teeth. Braces are common and other clear aligners are everywhere. So why is Invis the answer? transforming smiles with more sophisticated technology and data points from more than 8 million smiles for better predictability, Invisalign is the world's most advanced clear aligner system. A specially engineered, patented material that's proven to move your teeth more precisely and more comfortably than ordinary aligners. Your treatment plan is built based on your doctor's prescription and years of research and intelligence from millions of patients. So your treatment experience is personalized to you, and only you. You don't have to make drastic changes to your lifestyle. Because Invisalign aligners are easily removable, you can still eat and drink what you want, and can even play sports without worrying about broken wires or brackets. Straightening your teeth with Invisalign is on average 5 months faster than braces. Also, studies showed that patients treated with aligners had less plaque and better periodontal health than those wearing braces. And what's more, no accidents from broken brackets or pokey wires in your mouth. For more comfort and predictability than other aligners and a faster, better experience than braces, Invis is the answer to transform your smile.
Sometimes a tooth is removed and a dental implant is not placed right away. Without a tooth, the jawbone usually shrinks. The result is often significant bone loss. This bone loss isn't the person's fault, it's the natural resorption process that typically causes the bone deterioration. In order to have a dental implant and teeth at a later date, the person may need more bone to anchor the implant. There are several ways to reproduce the bone so that your jaw will be able to accept a dental implant. These are called bone grafting techniques. Socket grafting is bone added at the time of your tooth removal. The tooth will be removed and the bone grafting material will be placed in the hole left after removing the tooth for a 4-month healing process. The bone heals and the dental implant can then be placed. A tooth is placed on the dental implant. For patients that have more bone missing, a technique involving placing blocks of bone in the area with missing bone works well. The blocks are shaped to the desired size and place with titanium screws. They are left to heal for 4 to 5 months. When the bone heals, there is plenty of bone for a dental implant. When it is not possible to use a block, a softer mix of bone substitute is placed where bone is missing and covered with a tarp called a membrane. This graft also grows bone. When the bone heals, a dental implant is placed and allowed to heal, and the final tooth is placed on it. Bone grafting procedures are safe, and their success keeps improving with new technology. The main complications that can happen are failure to grow bone, infection, pain. All of these complications are usually easily controlled and treated with appropriate antibiotics and pain medicine. The advantages far outweigh the risks, giving you new permanent teeth that should last you a lifetime.